What's going on, everyone? I'm just a typical, average American here today to react and learn about some British healthcare stories. So, today, I really want to take a look at this Reddit discussion where somebody asked Brits of Reddit, what is healthcare really like in the UK? And I think this is a question that a lot of Americans really wonder about because a lot of us kind of understand the British taxpayer funded healthcare system available to everyone in Britain, or a lot of us Americans are at least curious about this. So today, I really want to hear from British people in this discussion about their actual personal experiences using this healthcare system and what it's really like and how it compares to our American system. So let's take a look at a couple of these comments here. Starting with, I asked my GP to put me forward for surgery in December. They said it wasn't urgent, so expect a long wait. Oh, that's kind of scary. A week later, I got a letter with an appointment for a week after that. Oh. I saw the surgeon, and the surgery is booked for February. February? That's only like 2 months after December. That's not bad for like what they said is a non-urgent surgery scheduled for 2 months later. That's really not bad at all. This isn't an example of how it always works, and believe me, I've had my battles. Oh, okay. But the government does the NHS a massive disservice, and when it works, it's brilliant. Oh, that's interesting. The government does the NHS, which is the British National Health Service, I think, is what that stands for, a massive disservice. So the NHS, what does that mean exactly? Is this like a normal criticism? The British government doesn't do a good job with what in regards to the NHS? They're doing them a massive disservice. That's interesting. I wish they would go into a little more detail about that criticism in particular. Um, because I'm not exactly sure how that works. I know that the NHS is like taxpayer funded, and therefore it's the British government collecting taxes, and then I presume giving budgets and money to the NHS. Is there more to it than that? Do they not do a good job at that? Giving them like money or budget or organizing, or I don't know. That sounds interesting. But this first comment, for the most part, is pretty positive, I'm gonna say. Pretty darn positive. Let's keep going. I lived in the United States until I was 30, and then the UK until I was 50. Oh, this is an interesting point of view. In the UK, they chased me down for blood tests every 6 months for my thyroid issues. They chase you down. They chase you down in the street. You're just walking to work or something, and they got their syringe and they're just chasing you. Give me your blood test. Let us help you. I don't know what that means exactly, but in theory, that sounds good. If in the UK, they're very passionate about making sure you're up to date on your exams and your blood tests. And in the United States, I wouldn't describe it as they're chasing us down to do anything. It's really up to you to do what's best for you. No one's really, I don't know. That's kind of funny. I got a medical exemption because it was a lifelong illness, so I didn't pay for any of my medication. That right, that right there, um, already leaves me speechless. Didn't pay for any of my medication. What a world to live in. What a country to live in. That's not at all the American experience. If I would have had to pay, it was like 7 quid when I moved there, and it went up to 9 quid by the time I left. I was suffering from depression. They got me into therapy. I didn't have to pay. I don't understand what this means. What does this phrase mean? I didn't have to pay. I don't know what those words mean. What is that? I don't know. Must be some kind of British phrase. I don't know what that means. In America, I never went for blood work because I kept forgetting. Yeah, I mean, it's not like none of us out here are getting our blood work. I don't know. They send you like an email sometimes. There's like an online portal where it might give you like a little reminder, and then you just show up for your blood test. I guess in that sense, it's kind of up to you to make sure you do it. I don't really expect them to do much more than that. I'm kind of curious what they're doing in the UK to like prompt you more to get your blood work and checkups done. Are they like calling you? Are they ringing your doorbell? Are they chasing you? Or my medicine was expensive. Therapy was not something that was encouraged. This is in America we're talking about now, because this person had experiences in both countries. The medicine can be very expensive in America, prohibitively expensive. It almost seems kind of random at times because here in America, it's totally based on the drug, the pharmaceutical company, how expensive it is to manufacture, what your insurance coverage actually provides you in terms of discounts. And that could change because there's a million insurance providers. So what one person has access to in America is different to what another person has access to. If it's in your insurance network, all these terms, it's enough to drive you a little bit insane. And I don't even think personally that I've had I haven't had that many serious medical issues personally. I guess I've had some things that, at this point in my life, I've had to interact with our healthcare system a little bit more as time has gone on. But compared to a lot of other Americans, like who are maybe older or have more medical conditions, I can't even imagine what their experience is like trying to get to pay for a lot of the stuff that they need. Therapy was not something that was encouraged. Yeah, is I guess in the UK because all of this. I guess because it's already known that you're going to have access to all of this stuff. Your doctor just kind of suggests things like therapy or different treatments to you because it's presumed you can just go get it. It's covered. You don't have to pay for it. In America, I feel like it's true. Like a lot of healthcare providers might not even suggest certain things because it's like, oh, therapy, that's that's really expensive. And depending on your financial situation, maybe they don't even care about recommending it, or they know it's not covered by your insurance, so they're like, oh, it's not covered by your insurance. I'm not sure if this is covered by your insurance, so I don't know if we're going to talk about therapy, even if you need it. I loved my experience with the NHS. It continually amazed me at how much better I felt going to the doctors in the UK. I really loved this comment because this was actually somebody who lived in the US and in the UK and experienced both. And they loved the UK experience. This discussion, not too shockingly to me, is incredibly complimentary of the UK system. American here. Now I'm a Brit who's been living in the UK for a decade. Similar experience. Treatment has been superb. I've spent maybe £20 the entire time I've lived here. 20. What? Huh? Eh? What does this say? 20 pounds total? Total? I mean, that's insane. Let's be honest here. People living in the UK, it's not like it's totally free or cheap. You're funding all of this through your taxpayer money. You're paying taxes for this, so you are paying for it in a different way. But gosh, that would feel so much better. I think, as an American, I think it would feel so much better to know my taxpayer dollars are going towards healthcare coverage. I would love that. I'd love that because in America we have a real problem not really knowing where a lot of our tax dollars are going, and our government is kind of infamous for not doing a great job budgeting, spending our taxpayer dollars, not being very transparent with what they're doing with the money sometimes. If I knew a large part of it was going towards healthcare, I think me and a lot of Americans would love that. I would love knowing that is what it's for. It's an amazing system. Dare I say, one of the most incredible inventions in human history. Let's go down here, get some more British perspectives on this. My experience is that it gets the job done. Most of the clinical staff does a sterling job. Quite a word. However, it is incredibly badly managed, with many wasted services and poor use of resources. That's interesting. So there are some criticisms here, especially from the British commenters, talking about how the government doesn't do a good job supporting the NHS, how there's bad management, wasted services. Some people believe that throwing more money at it will solve the problems. I prefer to think that managerial reform would go a long way for staff and patients. So who is managing the NHS? And what are they doing that's so bad? Getting some of these details would really be interesting to me. Sounds like Canada. Most of the destruction comes from conservative provincial governments trying to dismantle the system so it can be privatized. Oh, like America. Oh, no. I come from... Okay. We're getting really into the weeds here. I'm gonna keep this. I'm gonna go to some of the most upvoted comments here, just for simplicity's sake. My mom got diagnosed with breast cancer in early 2016. I'm sorry to hear that. She went to the doctors about a lump. A few weeks later, she had tests and got diagnosed. As part of the tests, they did a full body scan. They detected a separate cancer that was incredibly rare, to the point that only 2 hospitals in England could treat it. It's a slow-growing cancer, and they treated the breast cancer, gave her radiotherapy, surgery, then addressed the rare cancer. She got treated in Manchester, 10-hour surgery, was in the ICU for less than 2 days, and left the hospital in a week. She had 6-month scans for both cancers, received exemplary treatment, couldn't have been in better hands. This is just a great positive review of like a very, very serious medical condition and how it's handled in the UK. Her partner lost a leg. It was crushed by a car. He was in the hospital for a month. 5 surgeries. He got 5 surgeries in 7 days. He got physiotherapy. He healed up, has regular checkups, adjustments. Wow. I love the NHS, and it breaks my heart to see it being intentionally destroyed by the government that thinks the free market is the best way to provide health care. What does that mean? Does that mean in the UK you're going towards, like, the government is trying to push more towards a privatized healthcare system? Like here in America? Like where the hospitals actually are trying to turn a profit? Because let me tell you, that's not a fun place to be. It's not fun knowing that your healthcare providers are actually they're a business. trying to make money. That's not a great feeling. Um, and it's also not a great feeling knowing that your entire well being hinges on whether or not you have health insurance, which most people get through their job, um, and whether your health insurance company covers certain things. Um, yeah. And even that, even given that, if you go to the emergency room, if you need an ambulance, certain treatments that aren't covered, there's lots of things that are just expensive, even if you have health insurance. It's just expensive. And it's really up to the hospital to charge what they determine is a fair price, because it's just sort of like a open market here. No government intervention. Uh, and that's not a great feeling. So, I don't know. I don't know. I didn't know that in the UK you were trending towards that a bit. What exactly does that look like? How is that happening? And are people in the UK critical of that? And why is that happening? I didn't know about any of that, to be honest. I'm actually from the US, but I broke my pelvis in the UK. Outside of a really long wait for an ambulance, the care was stellar. Spent a week in the hospital, getting all kinds of scans, and I spent $5,000 because I didn't have travel insurance. In the US, that would have been like $300,000 or more. No kidding. Now, to be fair, that $300,000 would be covered by your health insurance. If you that's why if you don't have health insurance, you're going to go bankrupt. Like your life could be ruined if you don't have health insurance, because a lot of these huge medical emergencies leave you with a $200,000 bill because the hospital assumes you have healthcare coverage that's going to cover 80% of that, which still leaves you with like, a $20,000 bill depending. But I guess at least your life might I mean, that could ruin most people's lives, but $20,000 compared to $200,000, sadly, in our American minds, we're like, oh, that's a great deal. That's a great deal. Oh my gosh. The NHS does a brilliant job. Even if it's heavily underfunded by the government, why would it be underfunded? Why? Why are they doing that? Why? This is your taxpayer dollars. This is what it's for. And healthcare, if that's part of the government budget, you'd think that'd be a huge, huge budget item. Like, very important. Geez. It's also inefficient, wasteful, and badly managed. But to be clear, the frontline staff are brilliant and do a fantastic job. That's awesome. I actually think here in America as well, our frontline healthcare workers, our nurses and doctors, they're great. It's like our actual medical treatment is good. It's modern. It's good. The healthcare service is good. It's how you pay for it, and it's our insurance system and premiums and copays and deductibles and is it covered? That's where it makes you lose your mind a little bit. So I actually thought this was a really interesting discussion. Maybe for reasons I didn't even realize going into this. What is healthcare really like in the UK? This discussion kind of changed my picture of it. It's taxpayer funded. It's really, really good care. Every person in this discussion said they had a fantastic experience. It's really the only criticisms came from how the government is funding the NHS, how it's managed, which I'd love to hear more details on. That's sort of a thing, that's definitely a thing that you have to be British living in the UK to really know about, because I don't hear about any of that stuff. So this was actually a really cool insight for me. So anyway, if you enjoyed this, feel free to give this video a like or leave a comment, especially if you're British, if you know about this topic. you have experiences with British healthcare, the NHS, please feel free to leave a comment with your thoughts on all of this. That'd be awesome to hear about. And if you're interested in more videos like this, me reacting to Britain and learning about British culture, feel free to subscribe for more. And until then, thanks for watching, and see you next time.